see things around her growing and shrinking is a real medical condition. This medical condition is called micropsia. The Alice in Wonderland syndrome, also called micropsia, was first described in 1952 by C.W. Lippmann, according to Feldman. Dr. John Todd, who was a British psychiatrist, was the actual first person to give it its name, micropsia, and he did this in the Canadian Medical Association Journal. The author of Alice in Wonderland, Lewis Carroll, has recorded at least one episode of a classic migraine, and because of this, scholars have speculated that he may have experienced micropsia himself. Micropsia describes a set of symptoms with alteration of body image. It usually happens with small children between the ages of 5 to 10, and by the time that they get into adulthood, it usually resolves itself. The majority of people who have this disease have a family history of migraines or have migraines themselves, and the episodes are more predominant at night. There are many causes of micropsia. The typical migraine, temporal lobe epilepsy, brain tumors, and psychoactive drugs of the Epstein-Barr virus infections, according to Weisenstein, are the major causes of this disease. And the causes in children, which is the particular people that get it, is the Epstein-Barr virus and the mononucleosis. And Epstein-Barr virus is the virus that causes mononucleosis. And also there are some ingredients that are in cough syrup can bring on micropsia, and also partial epilepsy, complex partial epilepsy and drugs are also causes. There are certain tests and imaging studies that help rule out secondary causes, such as the urine toxicology screen, the test for mononucleosis, an MRI of the brain with and without contrast, and an EEG, according to Gaffer. The trademark symptom of micropsia is the classic migraine, and with the symptoms are an alteration of visual perception, and this includes like the sizes of your body parts and everything around you. It'll like grow and shrink and get big and small compared to you. And the person also who has these loses a sense of time. For them, like time either goes by really, really fast or just goes really, really slow. Like it's totally not normal. And these sensations that they get can either begin before a migraine or it can occur afterwards. And in younger patients, it can even occur without a headache, according to Gaffer. Treatment plans. Because there are so many different causes of micropsia, it requires many tests to come up with proper treatment. There is no proven cure for this. The migraine medications that are associated with micropsia, they just control the pain that micropsia can bring. It doesn't really stop all of the headaches or all of these sensations and everything like that. There have been many studies of micropsia. One in particular that was done by Dr. Sheena Arora. She is a Stanford neurologist and migraine specialist. She was studying a 12-year-old girl whose name was Anna Rysef, and she actually got a scan of her brain during one of her episodes. And the report that Dr. Arora did, it concluded that the electrical activity caused abnormal blood flow in the parts of the brain that control the vision and process texture, shape,